Hi everyone, and welcome to A&P with Dr. O. This image here is going to help us identify systemic arteries of the head and neck, and we will also review a few vessels from our previous video. Let's go ahead and start with some of our systemic arteries. I'm going to go ahead and start with our aorta down here. Again, it makes it easy to start with the aorta, especially if we remember our ABCs, because then we know that this is the aorta. The brachiocephalic, you can't really see. It's obscured right here, so we can't really see that one. But we can go ahead and see that we have our common carotids. So those are going to be right here. And then we have our subclavian as well. So those ones we will go ahead and label. This one and this one. These will be common carotid arteries. Again, I'm just going to use A for artery to keep it short and simple. And remember, carotid is Greek for stupefy. If we prevent blood flow through the carotids, then we prevent blood flow to the brain, oxygen to the brain. We prevent that oxygen from getting there, and therefore the individual may act a little strange, and of course this could potentially be a dangerous situation. Now, if we follow the common carotid, we can see that a portion of it is going to stay external, and then this little itty bitty portion is going internal. I'm going to draw a line from this small portion going internal. That then is going to be our internal carotid artery. And then the one that stays external, I'll draw a line from there, is our external carotid artery. And if we continue to follow this one that's external, then we find our superficial temporal artery. Again, superficial because it's more superficial than deep in terms of the vessels. So it gets a superficial designation. Temporal, here we can see that temporal bone. That's a kind of a landmark helping us to name then that artery. We also have vessels that are going to deliver blood to the face and the tongue. Here we can see our grouping of vessels delivering blood to the face. I'll go ahead and encircle those. They are going to be our facial vein and artery. The blue one on top will be the vein, and then the red one will be the artery, because remember, in systemic circulation, arteries carry oxygenated blood. That's why we use the color red. Veins carry deoxygenated blood. That's why the color blue is used. We then have this grouping of vessels here. They are going to be supporting the tongue, and therefore they will be the lingual artery and vein. And again, the oxygenated vessel will be the artery, and then below it, the deoxygenated vessel will be the vein. We have a few more veins I'd like for us to take a look at, and I'd like to start with the superior vena cava, just because that's a helpful landmark for us to start with. Here's our superior vena cava. It then immediately branches into brachiocephalic vein. I'll go ahead and note that here. On the right side, this would be the right brachiocephalic vein, and then I'll just use a B over here. This would be the left brachiocephalic vein. And then again, if we continue on, then we have our subclavian vein, and it is bundled with the subclavian artery. I'll label those as well. The oxygenated vessels on top, that's our artery. Deoxygenated on the bottom, that's our systemic vein. If we go ahead and follow these branches from the brachiocephalic vein, we will notice that one of the branches is going to stay external, while this other branch here is going to go internal. We can see it going into the skull here. That means that this is going to be our internal jugular vein, and then over here we have our external jugular vein. I'll go ahead and draw a line over here for our internal jugular vein. And then on the other side over here, I'll go ahead, let's see, I will sneak this line over to here, and that's going to be our external jugular vein.